Today, I'm delighted to be joined by Dr. Laurel, whose unwavering dedication to helping individuals overcome physical injuries truly commendable. Now, a little confession from me. I'm 70 and deeply committed to fitness and longevity, and even though I might have joined the fitness journey a tad later in life, I'm still committed to figuring out what it means to be more fit or stay fit as I get older. And like many who are passionate about staying active, whether it's through CrossFit or martial arts, or soccer, or whatever it is that you do to stay active, we all know that injuries just end up being an inevitable part of the journey. The real challenge, however, is how do we bounce back and return to our daily lives or the sports that we love? And while options like steroid shots exist, they're kind of a temporary relief. Sometimes you can get results, it just depends. But often it's a quick fix that doesn't stay fixed. So Dr. Laurel, with her extensive background in soccer and years of experience, is who I'm talking to right now. And I'm truly excited to delve into the unique insights of which she has to offer. Hi, Dr. Laurel.
Hi, Tom. It's great to be here.
I'm glad you're here. So I'm curious, what was it that first sparked your interest in physical therapy and working with athletes and non-athletes?
So I have a very classic physical therapist origin story, actually. It's the classic, I went to physical therapy myself because I tore my ACL playing soccer when I was 16. Unfortunately, all too common these days. That's another topic for another time. But I went through that process myself, had a bit of, now I don't feel ashamed saying it, but at the time I felt kind of weird about feeling a little depressed and definitely emotionally down during that time when I was, about 9 months until I could really make a full recovery. It's a long process, but I went to physical therapy. Shout out to my first physical therapist, Heidi, and she really was great about just guiding me through the process, right? She was not only showing me the exercises and the interventions that I needed to do throughout the whole process, but also was very motivating for me and made sure that I knew that I could get back to playing again, that this wasn't gonna, hold me back. I could get back to my same level of play. And I remember feeling like, I could see myself doing that. I think I care about people a lot. I could see myself helping them in this way. And that's really what first piqued my interest in physical therapy. And it just kind of continued to be what I wanted to do into college when I was deciding where I was going to go. And I ended up tearing my ACL again, but it just, at that time I was working with athletic trainers for the college because I was on the soccer team there at UT Tyler. And it was, again, though, going through rehab, having somebody there with you on that journey and encouraging me to get back to what I was doing and what I loved. That was very inspiring for me. And it helped that I developed a greater love and passion for sports, of course, and health, nutrition, and fitness along the way.
So you would call that essentially was kind of a defining moment for you?
Yeah, absolutely.
Or was there a point where that happened, but really sort of saying, okay, so the PT is where I want to do as a career? Did that come later, or it sort of?
I think it came pretty early. I would say I'm one of those people that I think when I get something in my head, I tend to stick with it and see it through as long as I feel like it continues to align with what I want to do. So I do really feel like probably when I was 16 and went through that process and first thought to myself, I think I could like this. I think I could be good at this. And then it just, I think, it's God has a way of really exposing things to you, but just the fact that I had to go through that again. I will say when I tore my second ACL, I think that was even kind of a secondary defining moment, if you will, because prior to that, after I went through the first rehab for my ACL reconstruction when I was 16, I had told myself, all right, I'm going to go back to playing, but if this happens again, like I'm done. That was just kind of my mentality. I was like, I'm not going through this again. This was really hard to get back to playing at that high level. And then sophomore year of college, about 4 years later, I did it again. And the mentality I had that time was, if I'm going to come back and continue to play the, remainder of my college career, I'm only going to do it if I'm going to come back stronger than I was and a better player and just overall, more athleticism and more skill than prior to this second ACL injury.
Was it the same leg?
It was the opposite leg.
Oh,
yeah.
Well, okay.
Which is really common. When you tear one, you're at a bigger, you have much more risk of tearing your opposite side ACL, actually. So, yeah.
Why is that?
Well, the reason, and you can tear the same leg as well, of course. But it has to do with the fact that when you tear one ACL on one leg, you've been compensating with your opposite leg for quite some time. And so you're making up for the fact that your, original ACL injury, that leg is dealing with a non-native ligament at this point. So it's never going to be as strong as it was originally. And so that compensation over time can put you at an increased risk of tearing that opposite leg.
So you have a lot of experience from the perspective of playing sports in a very active way and seeing how, it seemed to me, I was thinking about it beforehand, it's like, must be kind of magical in a sense, being on a professional or a college sports team. People are going to get hurt. It's just going to happen, right? And so I don't know if I read this somewhere or not, but this sort of the science of healing and recovery has changed a lot over the last 20, 30 years. And so they're able to bring people back. I mean, you see it even, I'm not a big football person per se, but you do see them come back with what sounded like some pretty terrible injuries, and they're back at it.
Yes. Crazy fast in the NFL. They definitely have, the best of the best in terms of their medical team, their rehab team, their strength and fitness teams. Yeah. So they've got some really advanced techniques. And so it is very much the truth that we are definitely making advancements all the time. And so I like to see the way we're going with rehab in general.
What type of people do you see in your practice?
I do see what I would call a higher level functioning population. And that just means
Active.
Active, but also, I do see people that are what we would call sedentary, but I'm not working typically with people that are wheelchair bound or that have extreme functional movement deficits. So I am working with people that are overall, I would say, active with some sort of activity or an athlete, and then on the opposite spectrum, people that aren't necessarily active but have a painful condition. Those are typically who I'm seeing.
So, kind of picking up what we were talking about before, in your practice, I'm guessing you can help me out here. You're utilizing a range of techniques, some of them probably fairly advanced techniques. How do you stay on top of the latest therapies and incorporate them into your treatment plans?
That's a good question. Well, I was lucky enough at Texas State, where I went to PT school. They had a large emphasis placed on evidence-based practice. And so that just means, what is the research actually telling us? Is this research backed? And how do we implement the latest evidence-based techniques and tools into our practice, and maybe take away or get rid of some of the ones that are no longer, at the top of the line in terms of making sure we're doing what's right and best by our patients to get them out of their pain or dysfunction as quickly as possible. Some of my favorite tools and techniques that are really kind of making a bigger wave in physical therapy specifically, and just across rehab in general these days, is dry needling, which you got to experience yourself.
Yeah, we're getting to that. Yes, I really want to know more about this. So keep talking. It's just fascinating.
So dry needling is by far, I think, my number one modality.
Why did you see or hear more about it?
Well, I think, that's a good question. I don't know if I have the answer, except for that, at least in the United States, physical therapy in general, I feel like I don't want to say 10 years, but probably 10 years behind where it should be.
In what sense?
And in the fact that we still have a lot of, yes, we have a lot of practices still that are using very cookie cutter approaches.
And that's why I asked the question initially,
yes.
Right? But I mean, so if I'm going to jump in here. But would you say if you were on one of those incredible recovery teams that you were talking about, like in the professional football and all that, are they doing things like that? The more advanced techniques?
They're doing the more advanced techniques. Yeah.
It's just not percolating down into the...
It takes about 10 years for things to percolate down, is what I meant to say. So we still have PT practices that are, everybody gets heat pack. Everybody gets the same 5 low back pain exercises. Everybody warms up on the bike. It's the same. And it's, we know that there are tools like ultrasound, for example, that are still being widely used today that we, know are probably not actually doing what we say that it's doing, or what we have said that it's doing, and really, are we doing anything? And even if we are making some kind of positive impact, is this the best treatment modality that we could be using? And the answer is no in terms of ultrasound. But that's just one example of, you can still go to a practice, in Austin, and you can find that very cookie cutter approach. We've stayed 10 years in the past, and we haven't really developed our practice or our skills or our mindset in treating patients since then. So I strive to be different than that. So yes, evidence-based practice and staying on top of the latest research and techniques and interventions is my priority. Absolutely.
So let's take a step back on the dry needling, because most people, I'm going to assume, don't know. What is it and why does it work?
Yes, I actually just recently did a clinic or workshop on this at one of the gyms in town at Sola CrossFit. And so it was a lot of fun.
And that's where we met, was Sola CrossFit.
That's where we met, yes.
Shout out to Sola CrossFit.
Yes, they're amazing.
Yes.
So, that was one of my favorite clinics that I've done. It was super engaging, super fun. Dry needling is the use of a thin or a skinny needle, and we insert it in through the tissue that we're trying to affect. Typically, we're targeting muscle tissue, more specifically they are often referred to as trigger points, those taut bands of muscle within a larger muscle group. That helps create what's called a local twitch response, LTR for short. That's that twitch that you will often feel if you undergo dry needling.
Yeah, it says, it's not like a regular needle. I mean, it is in a sense. It feels like it's a needle, but then it goes a little further and you feel something down in there.
Yes, we go in pretty deep. That's whatever we're trying to affect. You're trying to go down as far as the bone if you can, to make sure you're really penetrating through that whole tissue as much as you can. And then you do kind of move it around in different ways, affect a greater surface area. And it's that twitch response is really a release of spontaneous electric activity that helps relax and reduce muscle tone within that area. And it's pretty wild. You'll see the whole muscle if we get it in a good spot, in a big muscle. You'll see it twitch. And so I'll feel it, I'll see it. And then, of course, the patient is feeling that. But what it really does is, yes, it helps with pain. And it's not just the muscles, it's other soft tissue. We can use it for things like arthritis, so for cartilage, for bony disorders, we can even target the nerves these days. That's been a little bit more recent, and as well as other tissue, tendons, ligaments sometimes, and even joints. So it's a really amazing tool for reducing pain, bringing in blood flow to the area. So we know that that increase in circulation is really needed for treating most conditions. So bring in blood flow, which has other nutrients and oxygen, bringing that into the affected area to help stimulate healing, especially in these kind of more chronic issues where the body has kind of decided that this has been going on now. This is just part of what we're dealing with. This is now just a chronic issue. That immune response that you would normally get at the beginning of an injury, right? You sprain your ankle, you get an influx of blood flow, you have some swelling. That doesn't happen as much. And so that's why we use dry needling, and that's why
if you do it soon after the injury. Yeah.
Well, you can use it for acute injuries or for more chronic injuries.
Oh, okay.
But it is a serious game changer. I think it's my number one modality out of everything.
Well, I certainly experienced it. I know myself, I was doing some push-ups and, in retrospect, wasn't being very thoughtful in my approach of how I was doing it. I don't know, maybe I was just trying to catch an extra 5 minutes of exercise. I don't know what it was, but I had, my arms were not in the right place. And I literally, first time in my entire life, even from all those years of Aikido, I felt this pop in my right bicep muscle area as I was going down or up. I don't remember what it was on the push-up. And I went, holy moly. That was like a real, it was very real,
Yeah.
And then it wasn't long after that where I couldn't even raise my arm above my head. It was painful. And I went through some of the usual things, no, it's not surgery, and go to this PT, which I can't remember if I went to. I did go to one person for PT. It was sort of helpful, but then you introduced me to this, and it made a.
I know. Yeah, you had a very immediate improvement in your function and pain, which is really cool to see.
Yeah,
it's
amazing. It was helpful, and so I see the benefit of that and going back and continuing to work with that. Okay, just one other aspect on dry needling, just to the listener. This is not the same thing as the Chinese acupuncture.
Yeah,
right?
No, it is. The similarity is that it's the same needle as used in acupuncture, but the philosophy and the methodology is definitely not similar. I think acupuncture, can be very helpful, of course, but for dry needling, what physical therapists are using it for, we do tend to, I would say, go a little bit deeper into the muscle tissue. Depending on the situation, we may use overall less needles than you see in acupuncture. It varies, physical therapists and acupuncture, whoever your provider is and what they see fit. But, acupuncture is based on following meridian patterns and energy channels. And I'm not an expert in that, but that's the best that I can describe it.
Yeah, that's my understanding.
Yes. And so we are largely taking the dry needling and affecting an involved soft tissue usually. And so while there's similarities, I think the overall methodology and philosophy behind it varies quite a bit. Both can be helpful tools, though.
So, Dr. Laurel, you've worked with a variety of athletes at all levels, and also just with people who are very physically active or mildly physically active, and as we mentioned a bit earlier. How do you adapt your approach to meet the mentalities and needs of different types of people, regardless of their age or interest in?
That's a good question. First, I do often keep in mind what my college soccer coach, Stephanie Webb, amazing woman, she said to me one time. I couldn't even remember all the context, but I just remember this. What she said to me was that she can coach very differently depending on the player that is in front of her. And so while she may have no problem yelling at me on the field to change something or to do something better, and that would not affect me negatively at all. That would just encourage me to do better and to fix it, implement whatever she said. She may have to take a completely different approach to a different player on the team, because if she yelled at that player, it would really mess them up mentally, and they would be kind of in their head when they're playing, and that would make their performance suffer. And so I just remember thinking, wow, that's really cool that she does that. And then I started to pay attention to it on the field, and I was like, oh yeah, she really does kind of treat us a little bit differently, not in a bad way, but in a effective coaching way. And so I do keep that in mind, because there are so many different, or people have very different ways that they respond to what you're telling them. Some people you can give the tough love to. Some people, if you give them tough love, they're going to shut down, and yes, exactly. And they won't appreciate that. And and then you have to know, okay, well, maybe I'm working with a high level athlete, a college athlete or something like that. They probably are going to be more on top of their stuff. I can probably give them a little bit more to do in terms of their rehab plan or their plan of care, give them maybe a few more exercises or self-mobility techniques, something like that. Then I could give somebody else who, and this is not always the case, but just for example purposes, someone who's a little bit more sedentary, maybe isn't used to doing a regular or routine exercise or anything like that in this realm. And so I may have to start them with one or two things, because that may be, we've got to start building some habits and some consistency. And if I give them 5 to 10 exercises on their exercise program, they are probably just going to look at that and be overwhelmed, and then they probably won't do any of it. And so definitely taking different treatment approaches to different people, trying to acknowledge and learn to understand how people respond. Some people need to be coddled more, if you will, for lack of a better word.
Oh, yeah.
Some people can be pushed more. Some people are a little more independent. But what's great about my practice model is, because I have a smaller overall client volume, I can really fine-tune how I approach each individual client or patient, because I can have regular touch points between their last appointment and their next appointment, and we can communicate once or twice between those appointments, and that way they know that I'm on this journey with them. They have a resource to ask questions to. They can ask me questions, and I will really be on this journey with them. So I really like to fine-tune the way I communicate, the way I practice, everything from, yes, my communication, their exercise program. Do we need to talk about what's going to make you the most successful in terms of when you're going to do your exercises?
What advice do you have for people who might feel discouraged about the recovery prospect? That must happen.
Oh, yeah, definitely. I really love this quote that I think speaks to that well with regards to your question. It is by Bill Gates, and I think I've tweaked it a little bit to fit more of my needs, or my patients' needs rather. But the quote is, most people overestimate what they can do in 1 month and underestimate what they can do in 1 year. And so I find that to be the truth most of the time. We want, in this day and age, we really want that instant improvement, that instant gratification. And that is just not how it works. And when we offer in the health and medical industry things like a steroid injection, which you spoke about earlier, maybe a surgery, we're often trying to get a quick fix, which is ironic because any major surgery is not a quick fix. But I think people will sometimes opt for that instead of, well, let me see what I can do. Exactly. Can I put in this work and this effort? And of course, with the proper guidance and tools and techniques, can I solve this on my own versus resorting to these more damaging and way more invasive procedures? So I really try to be upfront with my clients and say, hey, this is what it's going to take. We're not fixing this in 3 weeks. You've had low back pain for 10 years. It's not going to be a month of PT, which is, what you might standardly get prescribed is, okay, 2 to 3 times a week, come to physical therapy for 4 to 6 weeks. Right. We see it all the time. Well, you've had back pain for 10 years. It takes 6 weeks minimum just to build true muscle strength. And so it's outrageous to think that we could make really too many gains in that small window of time. So I think it's important to just be upfront and really say, hey, I'm not going to, sugarcoat this for you. This is what it's going to take. I'm willing to commit to being on this journey with you. Are you willing to commit to what it's going to take to resolve this issue 100%, fix the underlying causes, and come out of this not only back to what you were doing before, but also, my goal is to get you better than you were before. Let's fix some of these other underlying issues that may have been contributing to your original condition.
Do you ever collaborate with a surgeon or other doctors on a patient?
Yes.
On an issue? How does that work exactly?
Yes, but
Well,
yes.
Yeah, I think sometimes you might have to encourage a doctor. It's like when I went to the shoulder and he said, well, you don't really need surgery. So who do you go to? Well, you could go to YouTube, and he pointed to a couple of places in town, but it really wasn't real helpful. I said, no, I need something a little more specific.
Just Google it. Oh my gosh, that's funny. It is hard, and I do know that physicians are very busy people. That's the system that we're in. They get to spend a few minutes with you on average, right? I'm lucky that I get to now with what I do and how I operate.
It's a great model.
To do more.
Model.
Yeah, 1 hour with you. But I do love to collaborate with physicians. If we're talking about a youth athlete, I really am wanting to be involved with the coach, with the athletic trainers, with any other rehab providers that they're seeing. I'm communicating with the parents, with the athlete themselves, but it's all really important, especially for youth athletes. But for the regular individual, yes, I will communicate with the physician. If maybe we're seeing really good progress, I want to let them know that. If we're seeing some delays in their progress, we're going to communicate about that. I also want to know if it's a surgical case, hey, how extensive was this surgery? And sometimes it's better to actually hear that from the physician than to just see the surgical report or the operating report and try to, interpret that. Yeah. So I love to, there's some really amazing orthopedists in the Austin area. So I do love to collaborate when I can.
Good. I hope you do more of that. So in your experience, what's been the most rewarding part of seeing people complete their recovery journey?
The most rewarding aspect is when I get to work with a client who maybe I would describe as somewhat hopeless, and they've kind of lost all hope that they are going to get out of this pain or this injury or this activity limitation. And they've seen other providers, they've seen the doctor, they've gotten the steroid injections, maybe they did get a surgery, but they've done everything. But maybe they even saw another physical therapist. But like you said, not all physical therapists are the same, just as not all hairstylists are the same, right? And that's my favorite client to work with, because that person has gone from a state where they really just are like, okay, I guess I'll give it another try, to, oh my gosh, we can get out of this pain and this dysfunction and see the light at the end of the tunnel and get back to really being more like themselves, feeling more like themselves, back to all their activities, not having a constant nagging pain, which can affect us, of course, mentally, physically, disturbing our sleep, disturbing our or increasing our stress levels, and yeah, so there's a variety of issues that can result with that.
Is another question I was curious about, and I kind of wish I'd actually asked this early on, was, do you work with people? I'm just going to say people, because the whole world is not involved in sports, right? But a lot of people are involved in being active. So let's say active people who may have some minor injuries, or not injuries, but aches and pains or whatever, that may or may not have ever really fully recovered from, but they're functional and all that. And they come to you, and and like maybe they say they're in a point where they're wanting to lift more, or just be able to do more physically, who are already active. Do you ever have those kind of patients?
Yes, that is actually what I aim to with my practice. Continue to go towards is that more focus on prevention and on overall elevating your physical health and wellness, and not being reactive, but being more proactive. And so I had a guy, he was a runner, and he also did CrossFit, and he came and he really just wanted to improve his squat form. And he had some issues that he thought were going on. And I was like, oh, well, we actually have a couple other things we need to clean up about this squat. You've got your hips shifting to one side and your trunk is shifting to the other side. We got to fix that. And so we focused a lot on that. And he really didn't have any actual, pain or injury at that time. But I can, I don't want to say guarantee, but I imagine that because we've improved these things about his squats, which is an activity he's doing all the time in real life and in his athletic activities or his physical activities, I imagine that he is going to, reduce the risk of injuries down the road from improving his squat form and technique, but also he, is going to perform better, which was his ultimate goal. He was more focused on performance.
That makes a lot of sense. There's a doctor here in town who's all about longevity. It's Dr. Attia, Attia, I think. I don't know if you've seen any of his stuff.
No.
It's just fascinating. One of his really interesting observations is as you age, you need to focus on maintaining your muscle size and whatnot through weightlifting and things like that. And that's fine. Everyone kind of knows that. But just he's talked in the context of VO2 measurements, just, trying to maintain your VO2 just as a runner may not be as useful to you when you're over 60 or over 50 or whatever as focusing on your weightlifting. And so he has a whole philosophy and thinking about this, which is really interesting. It's part of the reason what brought me to the conversation with you is just to learn more about, physical therapy and health and whatnot. But I have one final question for us. What legacy do you want to leave one day as a physical therapist and a healer here in Austin, Texas?
That's a great question. The way I would answer that is I really do want to help contribute to Austin growing and continuing to become more of an active city full of more active people. I do like to work with those clients who maybe are sedentary individuals. They work a desk job. They're, sitting for 40 hours a week and then they come home and sit more. I want to not only help them with their low back pain or whatever they're coming to see me for, but I want to help encourage them to become more physically active, because we just know that, like you were just speaking about, physical activity, having a lean muscle mass, having also good cardiovascular health, like you were also speaking to, is so important for longevity, right? For battling off diseases, preventing falls. Yes. Increasing your balance, right? And I really want to be a part of just helping that community with their physical health and overall well-being.
Well, that's great. How can someone get a hold of you?
So my website is athletesedgephysicaltherapy.com. That's a really good way
Great name, by the way.
Thank you. So that's a great way to get in touch. There's a form you can fill out if you have anything that's going on or if you just have questions that you can submit. You can also text our business number. It's on the website. Mm-hmm. And then the social media platforms that we have are also at Athletes Edge Physical Therapy. So that's Facebook, Instagram, and YouTube.
Yeah, I might add, having been to see you, is you also have a very nice accompanying system where once you've shown the 3 or 4 different exercises that you wanted me to do, for instance, I could go to this website where you had done, in many cases, the exercises, and you showed them again, which was like, okay, because I couldn't remember exactly how to do this and this. So I think you have a really neat system that you've put together. I like the way you present the whole notion of having a practice model. Because that's what it is. It is a practice. You're learning too as you go along.
Always.
Just like my dad used to say, when you're engineering, you have an engineering practice. Oh, yeah, it's more than just what you learned in school. It's what you learned in life. So
I like that.
I admire and appreciate what you're about and what you're doing.
Thank you. Well, I really appreciate you having me here today. It was so much fun. I love to nerd out on some of this stuff. And yeah, it was a great conversation. Thank you.